It's a great privilege today to have as a guest René Najera, who is at George Mason University, an epidemiologist, social scientist, and has thought a lot about social determinants of health and disparities and immunizations and the experience in America of different kinds of public health challenges. And I'm super interested to hear your thoughts. And just as we brainstorm, I'm sure other things will come up. So thanks so much for being a guest today.
Thank you. And, I don't want to correct you right off the top, but George Mason University is not my only jam. My main job is at the College of Physicians of Philadelphia. And also I teach at Johns Hopkins University in the School of Public Health. And of course, none of my opinions necessarily reflect those of my employers, but
Thank you.
Standard disclaimer.
Thank you for the disclaimer. Yeah, we all need to say that these days.
Yeah.
So maybe could you introduce yourself just slightly for the audience, talking about maybe your personal history and kind of what brought you to population sciences and sort of the urgent questions that you focus on. I mean, it comes from a sort of a personal place as well.
My goodness, yeah. I mean, do we have 10 hours, right? So I'm gonna have to give you the TLDR version of me. Originally from Mexico, I was born and raised right on the border with El Paso, Texas, in a town called Juarez. Some of your listeners may recognize it from a lot of stories about Mexico and the border. I grew up there until I was 10. And then when I was 10, we were granted permanent residence into the U.S. because several of my family members, extended family members, had been born and were living in the U.S. at the time. And we applied, and by we, I mean my mother, my brother, and I applied for residency 10 years before that. So right as I was born, we applied and we got it 10 years later. And so we moved to El Paso. We just crossed the border, crossed the political line there. But we were always going back and forth because at the time it was rather easy. We had a border crossing card, and El Paso and Juarez is one city that happens to be divided by an international border. I attended the University of Texas at El Paso to get my medical degree, my medical technology degree, laboratory technology, lab tech kind of thing. And with that, of all places, I landed in a little town called Waynesboro, Pennsylvania. And you want to talk about culture shock. I went from a place that was 80 to 90% Latino, with Spanish being my language that I spoke every day, to Waynesboro, which is 99% white, English 100% of the time. Very few Latinos there at the time that I moved there. As we old people say, at the turn of the century. And I worked in a small hospital there as a lab tech. And that really was my first, well, it was actually my second, my first foray into social sciences and social determinants of health and all that good stuff was when I was a student at UT El Paso. I got to see how people coming over from the south of the border, not just Mexico, but the rest of Latin America, were treated in the United States, and the diseases and conditions that they brought with them because of their situation, right? Tropical diseases, chronic diseases. This is the end of the 1990s, the beginning of the 2000s. So the sentiment against immigrants was certainly getting bad. The rhetoric was getting bad. You think it's bad now. This is a process that has been going on for decades. But anyway, once I moved to Waynesboro, I saw that the same things apply to many of the people there, even though they were, American, white, not naturalized, but U.S. born people. And I started to notice poverty had a lot to do with it. Wealth and the access to wealth had a lot to do with it. So I decided to go get a degree in public health at George Washington University. And from there, I went to work at the Maryland Department of Health doing infectious disease epidemiology. And throughout all of that, even though I was studying infectious diseases, other diseases and conditions, chronic diseases, they were all lumping up on top of each other. I was starting to see what we call the web of causation. And that interested me more, and I got it in my head that I was going to get a doctor of public health degree. And so I met a professor at Johns Hopkins University, Dr. Carlos Castillo. Shout out to him. He was my mentor then, is my mentor now, and he helped me successfully apply and get into Johns Hopkins University of all places, right? let's aim for the number one school of public health. And so I did, and I got my doctorate in public health in 2018. I've been bouncing around doing consulting, doing work for local health departments, state health departments, and now my main job is at the College of Physicians of Philadelphia, doing public health programming there, kind of getting the word out about everything that's going on related to public health, putting things into perspective, trying to help Philadelphia, one of the poorest cities in the U.S. It used to be the poorest. Now that's Houston. I don't think there should be a distinction. If you, what is it to be a poor city in the U.S., and we can discuss that later. But I also teach at George Mason University and at Johns Hopkins University for the next generation of epidemiologists and public health workers. I have a 8-year-old daughter. I'm married to one of the best physician assistants out there, who is, right now as we speak, she is testifying in Annapolis for several bills to do with healthcare here in Maryland, where we live. So quite busy, quite busy life, but always at the service of others, and that's something that has been always my calling. I don't intend to get rich. If I happen to make wealth, that's great for my daughter and for the people around me. But it's public service. I warned my wife when we were dating that I was always going to be in public service, and that I probably was not going to make a lot of money. And she just laughed and she's like, "I got you. I'm a PA. I'm going to work." And she does. And she said, "We're going to be okay."
Well, I'm sure that's one of the reasons she likes you.
Yeah, right. Like that was super sexy, I'm sure. So here I am, teaching, trying to educate the public. Most of all, it is very difficult to understand some of these topics, especially around topics like vaccination. If you're not good at chemistry, you weren't that good at biology. If you didn't get a college education, most of all, you're not likely to understand the complex concepts of vaccination. And so I understand people being hesitant and people falling for some of the things that are being said out there about vaccines. And that's it in a nutshell.
Yeah. So, can I ask you a personal question? So, would you speculate that your multilinguistic, multicultural, multi-class experience has given you empathy in a way that allows you to see outside of your own personal experience, to see how social determinants interact with public health questions, so that you have more imagination than many people because you've lived in such diverse and interesting backgrounds before, that you can see how much of a person's experience is local to their language, their culture, their neighborhood, and how much is truly universal, right?
Oh, I think so. Yeah, if you remember the movie Forrest Gump, he kind of found his way into all these situations that then informed him of the next step. For me with vaccines, it begins when I'm 6 years old. I'm going out to a little league game, and a dog bit me on the left hand, tore it apart, and the dog was found to have rabies.
Oh my God.
and,
Wow.
and my parents were obviously freaked out, right? They took me to the anti-rabies center in Juarez, which was a thing. It is now thankfully a clinic for animals, but at the time rabies was very prevalent in Mexico, especially in dogs. And they took me there. I got 7 shots of the rabies vaccine right in the belly button, which they don't do anymore. Now it's more regular spots on your arms. They took the fun out of it. But it was a harrowing time for my parents, and I remember most of it. I remember getting the shots. I remember the process. I remember my hand getting stitched up and rehabilitated. But it started a sequence of events of me being interested. Okay, what did they put into my body to save my life? Because they really did. And so it just started that interest, that learning. But at the same time, we were relatively poor. We were not well off families from both sides of my families. And education was very much a privilege at the time in Mexico. It was something that only people with resources did beyond elementary school, and most kids in elementary school did not finish elementary school. They went off to work because that was expected of them. Not for me. My parents recognized my aptitude, and they encouraged it. They bought me books, they bought me magazines on science and technology and things like that. And once we got to El Paso, they really pushed me to know this. But it's always been in my mind, right, that there's people out there that have these limitations, not because they don't want to learn, not because they are quote unquote ignorant or dumb or stupid or whatever, or the names that they are called. It's simply because life didn't lead them into that direction, and so they find themselves in that situation. And regarding wealth, again, poor families in Mexico. Grandpa had a facility where he processed hides and then sold the leather. So he had some money there, but it wasn't an outrageous amount of money. When we moved to El Paso, we were really poor. We were on public assistance for a while. And then Bill Clinton passes a bill that says that immigrants shall not get federal assistance. And so we were down to state assistance. And it was tough for a while there for mom to meet the demands of the household with the two kids and the food that we needed, etc. Um, and what really drove the difference between wealth and lack thereof is when I met my wife. Her grandparents were both in World War II, and when they came back, they made smart investments with the benefits that they had as veterans. The GI Bill, the low to no interest loans to start up businesses in Pennsylvania, working for the steel mills, etc., and making wise choices with the money that they had. And so it built up this generational wealth that now my daughter gets to enjoy through her mother. But the differences are stark when we look at each other's trajectory. My credit was awful when we got together, and that led to some situations where I didn't have money for rent, and I didn't, as an MPH student, I had to decide, do I keep going with this tuition at George Washington University, which is not cheap, and making the money that I was making as a lab tech. And I got a lot of help. A lot of help came from people at work who helped me. The Waynesboro Hospital reimbursed me some of the tuition money. So without that help, I don't get to be where I am today, and I see that, and I recognize that, and so I see myself and a lot of people that are struggling, and they're reaching out for help. And when people say, "Well, you should lift yourself up by your bootstraps," first of all,
Right.
that's physically impossible. Second of all, none of us are self-made, no matter what the story you hear. We all depended on the help of others, and unfortunately, some people stepped on other people to get to where they are today.
Well, I think it's an interesting, it's a tension in American politics and the political divide about how to weight agency versus structure. So there's always personal agency, a person's curiosity, a person's talent, a person's intelligence, and then there's structure, which is the GI Bill, the neighborhood you live in, the fact that you got accepted to a university and then they gave you a scholarship. So there's personal choices, yes, but also major structures that facilitate people doing better. And when you see these books like what are the 7 habits of really successful people, they never include people who have all those habits who never get ahead. And likewise, people who are tops of their corporations who didn't do any of those things. So nobody thinks sort of deeply analytically about what does this mean about agency and structure. And there tends to be very anecdotal, as you say, like people say, oh, look, well, I made it. So why can't you? But that's really ignoring the role of structure, right?
I avoid that. I avoid that at all costs, especially with the students that I mentor. I avoid telling them, "Hey, look where I am. You could be here too." Because I don't know the full extent of their life situation, and I recognize that it's very difficult for them to match what I did step by step, and even if you want to call it luck, that came along the way, right? The luck of meeting my wife, the luck of Dr. Carlos Castillo seeing my presentation on influenza and asking me if I really believe the crazy things that I was coming up with to do influenza surveillance, and taking that towards my application at Johns Hopkins. All these situations, right? So what I try to do is tell students, look, you've gone into public health. Odds are you're not going to be rich from it. Very few people do become wealthy from doing public health work, and they probably didn't get into public health for the right reasons. What I call the right reasons. But you are going to be rewarded in many ways, and I'm going to help you craft the best application that you can so you can get into the school that you want to. We're going to look for scholarships. We're going to look for ways to help you along the way. And yeah, you've chosen this path, but it's going to take a lot of outside influences to get you through it. Um,
Mm.
and that's when we get to discuss the social determinants of health, that's what it's all about. The best example that somebody gave me recently was an example of a menu. Do you really have choice if the people who are crafting the menu give you only the choices that are on the menu, right?
It's the illusion of choice,
The
yes.
illusion of choice, yeah. And do you really have an opportunity to be healthy if there is no fresh food around your neighborhood, if the neighborhood is unsafe and you don't feel safe going out of your house, if the built environment is not there for you to go out for a walk? or a jog. And even if you have all those things, what else is getting in the way? Do you have a sedentary job? Do you have to commute for hours to get to your work, to make the money that you need to survive? All these other things, right? And so we talk a lot about things like obesity and overweight. I've struggled with my weight for forever, and I have had people criticizing me and saying, "Well, why should I trust you on public health matters when you yourself are not healthy?" This is a
People
valid.
really,
Yeah,
wow.
they do, and this is a valid argument from their perspective, right? But we know that people with lived experiences are the best teachers. We see that in substance use disorder all the time. That you have people who use drugs or people who used to use drugs be the ones who can tell you the best information that you need to do and make an intervention. But besides that, it's one of those things that I used to take deep offense to, and it used to bun me out. But now I do understand where they're coming from, and to those who listen, I explain to them that genes, culture, society, and my profession all collided to make me gain weight. And my rhetoric to those who will not listen, who still want to argue with me on things, I say, well, okay, I'm going to go and lose a lot of weight. Let's make an appointment to meet in a year. I'm going to go on a crash diet. I'm going to starve myself. Then will I be correct? Right? Then will vaccines work? Then will masking and social distancing for the pandemic work? And if that's what it takes, then I'm willing to do that for you. And that usually leaves them stunned, like, because there's no answer to that, right? Like, okay, well, you were either I'm right or I'm wrong, and if I'm wrong because I'm fat, then once I get to a good weight, then I'll be right. How does that make sense? How is that going to change physics and how viruses work and other things? So it's interesting, all these discussions that we get into, but it leads back to how society views you, how politicians who are not like you, to be honest, and people in Congress are hardly like most of us, how they view things, and they change policy, and that affects most of us. And so it's a struggle. It's a struggle to make people see things so that they vote for their own benefit. They're not stuck on one issue or a couple of issues. They see the all the issues, and they vote accordingly to inform them to make the right decision, the evidence-based, science-based decisions. It's a struggle, but it's one that we in public health have taken on as part of this, what they call public health 3.0, but I'm thinking we're now probably in 4.0 after the pandemic, which is social determinants of health, political determinants of health, and the interaction of so many things besides our biology and besides our behavior to lead us to where we are in
Yeah.
public health.
I know you've thought a lot about vaccine hesitancy, and I want to get to that, but could we approach it through that scene you painted earlier of yourself being bitten by a dog with rabies when you were a kid? So there's two interesting things for me in that scene. One is that you were not merely frightened, you were also curious. So it's terrifying, yes, and you picked up everybody else's worry, but you had a personal curiosity about what was happening. And then secondly, your parents trusted the medical system enough to bring you in for treatment, right? So there's two things happening there. One is, this is really interesting. What could this mean? But also your parents trusted the medical model. And that's a big issue when you think about like COVID vaccination hesitancy. A lot of people were like, I don't want to put anything in my body that they've come up with, right? Given the long history of medical racism and just it's the terrible history, starting with Tuskegee, but it's been all for decades. So there's a long, difficult history of people not trusting, especially African Americans in Boston, is what I'm thinking, just not trusting the medical model. So early in the pandemic, the National Science Foundation did a survey of Black and Brown Bostonians asking, were we to have a vaccination for COVID, would you take it? And more than half said no. And so that is not the white experience in America, but that's a very deep, a deep trust-based barrier, right, to vaccine uptake. So what are your thoughts about that? Just first of all, with respect to your parents trusting that you would be treated well when they may not have had every reason to think you would, but also just more broadly, how should we think about that in terms of vulnerable communities?
That's a really good and interesting discussion. I believe now that if social media was around when that happened to me, I probably would have been in a lot of trouble, because the lack of resources would have led my parents to try to search for alternative solutions that were not as expensive as the rabies vaccine. Not that I'd received the rabies vaccine for free at that clinic, but today here in the U.S., people have to pay either out of pocket or convince the insurance company to pay, and it's not a cheap vaccine. So had that happened here, had that happened in the era of social media, Mom and dad probably go on social online, and God forbid they get influenced by somebody who says just take some essential oils or some, here I have some vitamins that'll help them. We know that doesn't
Ivermectin,
work.
here you go,
Yeah,
right?
yeah, and not just that. I mean, there's so many other things that are being recommended by people who are not medical professionals to be used off label for a variety of issues. The other thing is, thankfully, my parents, mom, she decided to be a lawyer and she went to school for that in Mexico. Dad was a car mechanic or is a car mechanic, and he understands complex mechanical systems. But they both realize the limitations of their knowledge, and they're not physicians, they're not scientists. And oh, by the way, at the time, there were plenty of cases of people dying from canine rabies in Mexico, and so it was a very real threat. So much so that the government invested a lot of money into creating all these clinics. You translate that to today. Sure, we see cases of measles, but thankfully, we don't see a lot of death and disability from it. Whereas before the vaccine, 500,000 people would get measles, 500 to 1,000 would die. A lot of them would end up in the hospital. Hospitalization is not cheap. But the vaccine has been a victim of its own success, right? Like now people say, well, everybody makes it through measles. Well, that's true because you either have really good medical care or you've been protected from it altogether from the vaccine. So it's one of these arguments that is based on all that. But I also think that we have reached a place of the death of expertise where people have this enormous power of information in their pocket, and there's a lot of disinformation and misinformation in there as well. And they trust that for some reason, whatever that reason is, they trust that more than they do a physician. I mean, we can talk about the reasons for that. It's definitely a coordinated campaign against what people often call Western medicine. But it's just the availability of all this information makes it easy for you to stray into those echo chambers and try to find the information that way. I had an interesting interaction last night on the train home. I was talking to somebody and I gave him my business card and he said, "Oh, you're the public health director at the college." I says, "Yeah." "And you run the History of Vaccines website?" "Yeah, yeah." "Oh, let me tell you about my experience with vaccines." And I was worried that it was this we're going to go somewhere with that. But he also kind of said, "Why do people don't trust? Why are people mistrustful of medical professionals?" And so I gave him yet another personal anecdote, and this is my style, is giving personal anecdotes of all these things. When my daughter was born, and they came in to give her the vitamin K shot and the hepatitis B first dose, the needles looked tremendously huge to me compared to her little legs. And I had to tell myself at the time that she was going to be okay. I had to engage the prefrontal cortex, access all of the information that I know about the vitamin K shot and the hepatitis B vaccine, and convince myself that she was going to be okay. That the odds were overwhelmingly in her favor, that she was going to be protected from post birth bleeding through the vitamin K shot, and she was going to be protected from hepatitis B beginning with that dose. And that's me with a doctorate in public health. So I can only imagine, again, going back to the earlier example, somebody that maybe took biology in high school but didn't pay attention, maybe took chemistry but doesn't remember any of that anymore. How does somebody like that see those needles and not be terrified, right? And then you go online to try to educate yourself a little bit more, and you find tons of disinformation, and you just fall for the trap. I completely get it. So I often put people into different buckets when it comes to this. The people who I understand why they're vaccine hesitant. I understand them being afraid of vaccines and other medical interventions, and the people who should know better. The people with maybe a law degree, with access to a lot of experts who are maybe heading up a federal agency, right? They should know better. Same thing with people with medical degrees. I don't, for the life of me, I don't understand how somebody with a medical degree would be anti-vaccine, and not only anti-vaccine, but an activist at that. So for the latter group, I it is what it is. We can always just correct their misinformation and disinformation. But for the previous group, the parents that don't know better and fall for these traps, I have a lot of empathy, and it's a different approach to them. It's all about having a conversation and opening up that
Do you
discussion.
do you think what you had said earlier, that we are a victim of our own success? That's a major contributor as well. The fact that people no longer die of these preventable diseases because vaccination programs have been so effective. I tell my students sometimes, take a walk through an old New England cemetery from the 18th century and look at the gravestones. The ages of the people who are lying there are like 2 months, 3 months, 5 months, 1 year, and then there's a big gap. Then there's women who die in childbirth, there's men who die in wars, and then everybody else lives to 99. So that's the distribution of ages in a New England cemetery from like 200 years ago.
Yeah, and again, just like any other science, history is not always available to everybody. And we saw that during the COVID pandemic. One of the things that we did when I was working at the Fairfax County Health Department is we had these not town hall meetings, but it was more of a focus group discussion with people about the pandemic and would they take the vaccine? Did they understand what was going on? Things like that. And some of them referred, especially African American folks, referred to Tuskegee, and they call the Tuskegee when the scientists gave people syphilis. Well, no, the scientists did not give people syphilis. The scientists prevented people from accessing information about syphilis, from getting the care that they needed for syphilis, and they used them as natural experiments to see where syphilis would go. Even after antibiotics came online, they denied the antibiotics. So no, they had this idea in their head that the scientists went in and singled people out and gave them syphilis. Where no, these were people who were catching syphilis, quote unquote, the natural way, and they were denying them without their knowledge a lot of access to therapies that could before antibiotics, treat the syphilis, and after antibiotics cure syphilis. And so those little corrections, right? They some people may say, well, it's semantics, but no, it's very important to know the history, and history is being bent into all sorts of different directions now with things like not only the disinformation and misinformation, but the AI slop that is now making its way into history videos, history podcasts, things like that. If AI is dreaming things up that are not true, but if you don't know anything about it to begin with, much like with science, how do you know that it's not true, and how do you know that it's difficult to really sort the two things out? So it's you see this history going on, and you think, and like you said, tell your students to study these historical things, but there is a method to doing that as well that will lead you towards the truth and not away from it.
So who's
again, the average person doesn't have time for that, right?
But who's benefiting here? Who benefits from vaccine misinformation? So you're distributing all this stuff and making people afraid. Well, is anyone benefiting, or is it simply destructive?
I don't know. That is a really good question. If I were a conspiracy theorist, which I'm not, I rely heavily on data and evidence. But if I were to dream up a scenario where somebody actually benefits from all of this, it would be the people who sell alternative, what we call supplements, complementary and alternative medicine, SCAM for short. They sell these things, and they are the ones who, if people are generally healthy from vaccines, if they don't get things like chickenpox, they don't get things like measles and other things, then those people are not going to be seeking cures for them. And we know that for a lot of these viral diseases, there's no cure. There's a treatment, and so they benefit. They would benefit from that. But I don't know if that is really like a major thing. I do think that some people just like to be in the limelight. They like to make a name for themselves, and they do so by being, the maverick physician who doesn't go with the quote unquote establishment, things of that nature. We've seen examples of that throughout history. But as to who really benefits, I don't know. I think if somebody's actually making money off of this, and I'm sure there are, they're doing so because they're selling a supplement, a complementary alternative medicine to whatever the people are afraid of, vaccines in this example.
When you mentioned that, I think of Peter Duesberg at Berkeley, who made a career of denying that HIV was a cause of AIDS, right?
May he rest in peace. Correct. He just recently passed away. Unless I'm killing him ahead of time, but no. It's you write books and you get your name out there. And right now, society is such that currency is in likes and clicks and followers and things of that nature. So, and in the past, it was the same. In the past, it was newspaper subscriptions. It was how many of your newsletters could you get out there. The Anti-Vaccination League, in its day, it started in the UK and then spread throughout Europe and the US. They charge, I think it was like a nickel, which at the time adjusted for inflation was probably a little bit more than a nickel, but they charge a nickel to get to their newsletter. You just had to mail them the nickel, and then they would mail you back the newsletter. And if enough people do that, by the power of exponents, you can get a lot of money from that. And so, yeah, it's been throughout history, the being seen as an expert, being seen as likable. And where does that get you? It gets you to the Oval Office, right? You win a popularity contest, and you can get into elected office. You win a big enough popularity contest, and you get to be the president. Whether you have the skills to be a policymaker or not, that's how it is. That's how we've set up the system, at least here in the U.S. So it's that too, that benefit of having the clicks and the followers and the likes and having name recognition. I see it all the time on LinkedIn. I see it all the time. I see a lot of folks, and I warn my students and people that I mentor against this: of don't fall for the trap of trying to make a name for yourself on LinkedIn or any other social media, because just as fast as you can make that name, you can also get burned by posting the wrong thing, reacting the wrong way. And I've done it. I've reacted. 20 years ago, I had a bad reaction to a social media post by an anti-vaccine person that got me into a lot of trouble at work. So I'm trying to tell people to avoid that. And, I do have some hope, because my daughter right now, she is learning about verifying sources, checking the claims of things that she sees online, and then also being very limited in her online interactions. Of course, she's 8, yet to be determined how that changes. Yeah. But I am encouraged that in the curriculum at her school, they're including this package of information on social media and the new way that we're communicating.
Well, she has you as her dad. I can't think she could do any better than that, right?
Well, yeah. I mean, it's always our job to pass on our knowledge to them, and it's up to them to turn it into wisdom, and vice versa. I can give her all the wisdom in the world, but if she's going to have to go and search the knowledge to validate whatever I tell her. But it's funny, the world that we live in with regards to communication. That is currency right now. The number of followers, the number of clicks, the number of likes is money. Literally in many cases, and it's an interesting development in human society.
But also, we're talking here about a much deeper problem, which is the death of expertise beyond science. Just like all kinds of expertise is being rejected. So this happened actually with Brexit in the UK. So infinite numbers of economists were saying Brexit's going to be a terrible idea for the UK economy, and then the political people are like, "Oh, that's all we need, more experts." Great, they're wrong. And so just follow me. And then it is a disaster. And so people are like, oh, wait a minute, maybe we should have listened to the experts. Well, this is where we're at. So it's the death of expertise. And I don't understand, in a country where the Apollo program put men on the moon and then brought them home safely, right? So that wasn't that long ago. We trusted science to get these things done, and in a very public way, at high risk and big success. And now suddenly everything is suspect. I don't know how we got there. It's a terrible puzzle to me.
So a couple of things there. One of the shticks of a lot of these misinforming and disinforming people is to make you believe that you are in the minority or that they are in the majority, when it is not true. There was a recent survey of parents in Florida. Something like 75 to 80% of them still trust the vaccine schedule as it is. They don't want it mess with. They don't want it changed, when authorities in Florida have been threatening to change things up. There was another survey, a little bit more national, same thing. 80%, almost 90% of parents were like, no, don't touch vaccines. They're fine the way they are, especially MMR vaccine and a couple of other things. So, my belief is that people who are misinformed to that degree, they're not in the majority. There are very few of them, but they are loud. They are influential, and it's spreading like contagion. Whereas, yes, right now they may be 3%, 4%, but they're going to get to a critical point where it's going to start triggering problems, not just in infectious diseases, right? Get below 95% vaccination on measles, and you start seeing more outbreaks, and then you start seeing deaths, and so on and so forth. But as you said, there's these other we call them fringe groups. Flat Earth. What are the consequences of flat eartherism? And people sometimes laugh of like, oh, you believe it, there's a flat Earth. What's so bad about that? Well, you start seeing it in the attacks on other sciences, and I don't mean just physical attacks. I also mean, just harassing of authorities, defunding of projects that would benefit all of us, because of people that are saying not just the Earth is flat, but they're saying there's chemtrails of being delivered by planes. There's space lasers starting forest fires, things like that. It just starts spreading, and we in public health, one of our main jobs is to recognize these threats and stop them before they spread. And that is the stage that we're at now. We've recognized the threats. Now we're trying to stop them, even though they're in the minority. We're trying to keep them from blooming. And in some instances, it's working. In other instances, I think that we're falling behind. Certainly, there's some room for improvement on all of this, and I'm very hopeful about a lot of things. But that's just my personality. But I recognize that we are in a stage where, especially in the last year, unfortunately, what was the champion of science and technology in the world, which was the U.S. federal government, has become its adversary. To be
Yeah,
honest.
that's really quite tragic. I would you speculate that some of this either conspiracy thinking or am I in the minority is being driven by concerns about the locus of control? So there's a concept in sociology that if you feel you have locus of control over your own life, the ability to shape your own destiny, that you're not going to be a victim of neoliberal economics, but that you yourself are respected as a consumer, as a person who can vaccinate your children or not, bring your children to school. Do you think that there's been a gradual reduction of this locus of control in American society? People feeling like the world is out to get them, the system is rigged, elections are rigged, the economy is rigged, white collar criminals are never punished. And so people see this over and over again with the housing crisis, with the economic crises. And then people look at that and go, well, the system is designed to exploit me. And so that leads to conspiracy thinking, like they're out to get me. And so, oh, there are other people who think like me. And so there's a kind of a group bonding, a kind of a group support that occurs when we all are in the minority with our highly unpopular opinion, but at least we have each other. Do you think that's a driver?
Absolutely, and we see it in public health as well. We see a lot of instances where people feel that they have no control and they lash out against public health authority, um, because this thing has happened. And the best example, again, COVID-19, right? Pandemics happen; they happen all the time. They happen more often than we think. We're living through the seventh cholera pandemic that has been going on since the 1960s, but it's happening over there. It's happening in countries that don't have the potable water systems that we do here, you know. But then all of a sudden, COVID comes around, and there's nothing, absolutely nothing you can do to stop it. We can try to mitigate the effects, right? We try closing the borders, keeping people from traveling, social distancing, masking. But at the end of the day, it's a respiratory virus, very hardy virus, that very infectious, and there was nothing we can do, and that frustrates people, right? Because all of their lives they've been led to believe that technology and science is this thing, either through popular media or other things, that we're going to stop a pandemic from happening, we're going to stop people from dying. And when they see that doesn't happen, who do they blame? Right? They blame Dr. Fauci, for example, a lot of public health officials that had to quit their jobs and move away and go into hiding because they were being accused of either causing the pandemic for some reason, or they were accused of not doing enough to keep it from happening. And so, very powerful. Fear is a very powerful thing, and we see it all the time. So yes, I agree that. This lack of control, really, or perceived lack of control, is really something that drives the reactions that we're seeing now, towards science in general, medicine, public health in particular. But it doesn't have to be that way, right? If if the vast majority of people understood how viruses can jump from one species to another, and demanded of their elected officials and health authorities around the world to do things to keep that from happening, to fund systems that detect this the moment that it happens, and try to stave off the major effects, then things would begin to change. But again, we go back to the beginning of the lack of understanding of these situations. Chronic conditions are the same way. If I were to show you a diagram of human metabolism, you would just lose your mind. It is so complicated. So many steps happen inside of our cells, that from the moment that you eat something to when you burn it off as fuel, or when you store it, or when you secrete it, it's phenomenal what goes on. And if you don't understand that, then a disease like diabetes is going to be very, very difficult for you to understand. What do you mean I can't eat sugar? Right? I'm actually really thin. Why should I not eat sugar? Sugar makes you gain weight. Well, you have diabetes and your body has started to burn off fat now for fuel because it cannot burn sugar, and that's why you've lost weight. And so, or what do you mean I shouldn't eat fat? Right? What do you mean my dad died of a heart attack, but that was because he worked in the steel mills all his life. His heart just got tired. No, it's likely because of his diet and a combination with his genes and the environment that did this. So it's just this perceived lack of control really makes us, and I've fallen for it as well. Nothing frustrates me more than when I'm sitting in traffic. There is absolutely nothing I can do about it. I'm going to be late to the meeting. I'm going to be late to the class or whatever. I have no control over it, and it's very, very frustrating for me. And so that, then but I have the tools that I've learned over time to be patient about it, to maybe get on the phone and send out an email to the students or to the boss saying that I'm running late, mitigate the effects, right? But a lot of people don't have that. And especially if you're busy trying to make it day to day, month to month with your rent and things like that, you don't have time to not be frustrated, to not feel like you're out of control, and to then hear somebody who is, a slick talker, and it's telling you it's not your fault. It's this somebody else's fault, and name a group, name a person, right? While there's truth to that, it's not your fault in the absolute. When they point the fingers at something else or someone else, that might not be true, and that's what starts making problems.
Do you think the underlying force here might have to do with the American idea of freedom? So freedom not to wear a mask, freedom not to be vaccinated, freedom to carry my gun wherever I want. The sort of these ideas that people should just leave me alone and I should be free to do whatever I want, regardless of the consequences for myself or other people. And so you hear this constantly about the mask mandates, right? Like, I should not be told to do this. I should not be told to be vaccinated because I'm a free American. Leave me alone. Is that the driver of a lot of this?
Yeah, we see it in public health when like you said, the masking. I had a neighbor in my neighborhood, suburban Maryland, outside of DC, who came to me and said, "Hey, man, I know you're working at the health department. You're trying to help us out with the pandemic and everything. I just don't like being told what to do." And I looked at him kind of funny, like, well, okay, what do you mean? And he said, I don't like to be told what to do. I've served in the armed forces, and I, served with the idea of keeping people free. And when you tell me what to do or tell anybody what to do, you as the government, you're infringing on those ideas. And that led to a discussion about rights and responsibilities. We all have rights, but we also have responsibilities. If you take a close look at the Declaration of Independence and at the Constitution, if you look at state constitutions and laws, yes, there are a lot of enumerated rights in there, but there's also some responsibilities, right? We have the responsibility to vote for our elected officials. We have the responsibility to follow the law, or there will be consequences. So there are responsibilities that we need to take collectively. And you say collectively, and people immediately jump to collectivism, and they immediately jump to socialism and communism. So no, as a team, we need to take some of these responsibilities. I used to be an absolutist when it came to gun control, especially having seen a lot of violence in Mexico of what guns can do to people. I saw people, what a gun could do to a person, and that just made me so averse to firearms. So as I got into public health, I was an absolutist. Let's just get rid of guns altogether. Firearms, why do we need them? Countries like England can get along very well with very few people armed. We're not England. We don't have the socioeconomic levels that they do. The small size, the more, more cohesiveness of a small country like that. And so I started researching the subject. I had, again, good mentors at the different universities that I went to. And I got to the understanding of, like, okay, well, let's do harm reduction. Let's do the harm reduction approach to firearm safety, right? Look, I told this to a friend who had several. He opened his armory to show me all his wonderful toys, and he's like, "You want to hold this gun?" I'm like, "No, I really don't want to hold it. It doesn't have a bullet." No, I don't. Like, thank you, but no, thank you. I said, "Look, the best thing would be for these firearms to be out of the house. You have children; they're going to learn how to get into and have access to them. That's the best thing. Just get rid of them. Boom. Short of that, okay, then store them in a thing that is as secure as possible so that the children don't get into it. Short of that, then teach the children that these are things that are not to be played with. They're not toys. They're for self-defense, for going hunting, whatever you want. There's different levels going all the way down to okay, you know what, just keep your guns and do whatever you want. But that's not the level that we want to get. And we do this with smoking, we do this with substance use, we do it with weight loss, we do it with other public health issues. And so you have a freedom, a certain freedom that is, in this case, in the Second Amendment, and I'll leave it up to the lawyers to discuss the full interpretation thereof. But it's there. And so it is if not number one, it is really up there in the number of injuries and deaths of children, more so than in a lot of infectious diseases because of vaccines. So what do we do about it? Can we use the harm reduction approach to it? And can we make people understand that they have the right to possess a firearm as prescribed by law in their locality, but they also have the responsibility to not have that gun available to a child, to somebody who may hurt themselves, to not get it stolen and be used in the commission of a crime, things like that. So I think, and again, I'm being super optimistic, and it's just based on my own experience. Most people are very reasonable once you have those discussions. But then we get into the subject of discussions, right? We like 180 character messages on social media, 30-second clips on YouTube, instead of nuanced and discussions that can lead to a resolution of differences and a plan on how to fix things. It just doesn't happen anymore.
Well, I think most adults intuitively understand that trade-off between freedom and responsibility. Your neighbor who doesn't like to be told what to do, I'm sure is perfectly fine stopping at a red light. I mean, the red light's taking away his freedom to drive through the intersection. But there's a shared responsibility that when the light is red, I stop. But that's just a suggestion. He's perfectly free to drive through that intersection, right?
Yeah, and we have engineering controls as well for a lot of things that he and others may not be aware of, right? With the things that keep us safe, and we're not really fully conscious that they're there. The little ring in your car reminding you to put on your seatbelt that will not go off, turn off until you put on your seatbelt, is one of them. You have the freedom to not wear your seatbelt, but we're gonna annoy the hell out of you until you put on your seatbelt. And the argument is, well, if I get hurt, how does that affect you? I don't know, man. It could be because you're a firefighter. One less firefighter at my firehouse is not a good thing for me. So please wear your seatbelt. Things like that. I don't know. Your children want to see you come home. So yeah, it's a complicated thing. The interplay in public health. In the United States, public health is political. It is determined by politicians how much funding goes into public health programs. Elected officials appoint people who then guide public health responses and public health services. And so who is at the helm really determines what kind of public health things happen. Not so in other countries. There are public health boards that are more independent. They kind of act like the Fed here in the U.S., which is something that I wish we had in public health. More independence from politics. But it is what it is, and we have to work with it. Some of the brightest minds that I know have survived many administrations that swing from one side to the other on the political spectrum, and they have done some really good work. But I bet it must be exhausting. And so I listen to their stories, and it's like, how did you get through the HIV epidemic in, name a large city, when, the people at the White House were, number one, not willing to fund. And when they did, they restricted the funds on a lot of research and response to HIV. It's interesting to me to learn from them. But it is what it is here in the U.S. And similarly in countries that are set up the way that we are, and that causes problems. Of course, the other end of it is an authoritarian government, right? Cuba got rid of mother-to-child transmission of HIV. They've eliminated a whole bunch of maternal-child mortality issues. But what is the trade-off there, right? You're living in an authoritarian government that has brought on a lot of issues of its own. We can get into the discussions about that, but you don't have these public health issues, and so I've meditated about it a lot. I've written about it a lot. It's hard to to find a balance. I hope that we mature as a species. We haven't been around that long,
Hardly at all. Yeah.
historically speaking. Yeah, we're not even a blink of an eye at this point. But I hope that we do. I'm hopeful that we do. I've watched and read stories, things like Star Trek, right? They go through World War III, but then look what happens afterward. Humanity really changes, and everybody gets their act together. Maybe it'll happen, maybe it won't, but I'm hopeful that it does. And I was talking to my wife the other day, and my daughter, if she gets to live out her full expected lifespan, she's going to see 2100, and what fantastic things is she going to see between now and then. And the counter argument to that is what horrifying things is she going to see between now and then. And so we hope to give her the tools necessary, her and her friends, and anybody who will listen, my students, my mentees, the tools necessary to get to 2100 and be in a better place than we got to 2000. Because that's that's my job. That's who I am. That's what I want, and so that's what I wish. I know that along the way we're going to have all these things happen. We're going to have the rise of anti-science people coming into power, as we have seen recently, and we're going to have to deal with that and deal with it professionally and with the tools of evidence and science and everything that we have at our disposal. And I've had students and others say, why do you keep being so professional towards them? Why don't you call them liars? Why don't you call them whatever? Maybe a younger me would have done that. But if you have a parent who is vaccine hesitant and they're sitting in the middle of a room, and you have me on the one side and anti-vaccine activists on the other, and we're yelling at each other and throwing food at each other, that parent in the middle is not going to recognize the difference between the two arguments, right? However, if I'm calm, composed, professional, I bring the evidence, I bring the data, and the other guy can do whatever they want. The parent's more likely to go with the more, the person that seems a little more sane.
They may not understand the science, but they trust the speaker, right?
Yeah, and trusted messengers is also a very important thing. One of the exhibits that we have at the college, at the Mutter Museum at the college, is called Trusted Messengers. And it was all about how during the pandemic, Black physicians and Black healthcare workers went out into Philadelphia to explain to the Black community the necessity for social distancing, masking, and eventually vaccination. And they trusted, the African-American community trusted them, the Black doctors and experts, more than others. And we saw this in the focus groups that we did in Fairfax as well with Latinos. And when the Latinos in those focus groups heard that I was getting my vaccine, that my daughter was getting my vaccine, their vaccine, they really went along with it. They really like, oh, okay, well, if you're doing it, then let me know how it goes. And then they changed their mind. And same thing with the trusted messengers in Philadelphia with COVID. We see that happening also with the gun control issue. When a sheriff or a veteran talks to other gun owners and says, look, I'm a gun owner and I use guns as a tool in my profession. Please keep your gun safe. People are more likely to listen. And this happens all the time. Parents listen to parents. White people listen to white people. Black people listen to Black people. Latinos, we listen. Why do all the kids sit in the lunch? It's a really good book. Why do all the Black kids sit together in the lunchroom? So we have our own little societies and our own little communities, and that may not necessarily be a bad thing if we listen to each other, and then we as communities learn to have points of contact with each other and work towards something greater. It's hard. It's super hard to do. When I moved to Waynesboro, and hardly anybody looked like me. I think the only other two Latinos worked at one of the restaurants there. It was a little bit difficult, to be honest, to hear, to integrate myself into the society there, to hear nobody speak Spanish, to have nobody to relate to. So I code switched, which is, in some cases can be bad, but I did it as a survival tool. And then I changed the code again once I became, quote unquote, a pillar of society, right? Once people were, oh, he's a lab tech. Oh, he has a bachelor's degree. Oh, he's kept himself out of trouble. And I switched back. Not only have I done all that, but hey, by the way, at the time I was still a permanent resident. And then when I became naturalized, I'm an American, and let me tell you my life experience. And that's the stage where I am right now. But it's difficult to do. I keep saying that to everybody who will listen. Is This is not going to happen overnight. It's going to take a long time. You need to be patient. Easier said than done. Um, and in my position of privilege right now, it's super easy for me to say it. But I've also been there, and I also understand what it takes to get there, both as an individual and as part of a community.
Well, I think
And I'm hopeful that we do
it's
it.
also about the social contract. Who do I share a social contract with? Who is going to look out for me, take care of me? Will the government take care of me? Is the government's recommendation good for me, or is it just designed to make money off of me? And the sort of the trust in the government, the trust in people in authority, that's been undermined pretty decisively lately. When you think about armed federal agents abducting people from cars, that attacks a whole sense of whether the government can be trusted. So that has knock-on effects about vaccine recommendations. When you see armed agents abducting people, because now you don't have a social contract with anyone any longer. Everyone is suspect, right?
In 2016, I traveled to a U.S. territory that shall go unnamed, but your listeners who know me will know what I'm talking about. And I traveled there with the Centers for Disease Control as part of the response to an epidemic. And we were advised, we were not ordered to, but it was in our best interest to identify ourselves as being part of the local health department, because the locals there had no trust in the federal government of the United States. Their territory. They're U.S. citizens, but they are mistreated and regarded as a different country all the time.
I know what you're talking about, and it hasn't improved.
And so I did that. And then I decided to conduct my own little experiment. And yes, in fact, yes, when I identified as being with the response from the Centers for Disease Control and Prevention from Atlanta, it was a much different response than saying, yes, I'm Mexican. You understand my Spanish, but it's a whole different Spanish, but I'm working here with the local health department. Oh yeah. Come into my house, check this out. Let me tell you, much different than that. And, again, history, how the federal government has treated that part of the world, and culture, and then, people's understanding or misunderstanding of what we were there to do. When I hear of things that have happened recently with the immigration enforcement, they're not doing us in public health any favors, because eventually it's going to get to the point where if we have another major public health emergency, maybe in this administration, maybe in the next one, maybe in the one after that, and CDC tries to respond, we are not going to be, not that I'm in CDC right now, but if I were part of the CDC response, people are not going to respond to that because of the fear that the federal government is causing in certain communities right now. And not just certain communities. I think it's spread now, right? Like it's pretty clear that the fear is spreading to other people other than people who are either undocumented or have a surname that is not of European origin.
Everybody's affected.
Yeah, and they're not doing us any favors, and that's my opinion about what's going on there. Is you're not doing me any favors. You're not doing anybody any favors, obviously, but it's going to be like Tuskegee. It's going to be like the experimentation in women in Central America, in the Caribbean, for certain medications, things like that. They ruin relationships. And so how do you mend that? It's an impact on public health for sure. And so I wish it wasn't happening. And certainly some of my colleagues and myself have been thinking of ways to mitigate those effects. It's difficult. You have a situation that is bringing together so many different aspects of our society and policy, and it's just causing trouble for everybody.
Well, I think most of this bumps up against the problem of that could have been me. And so to the extent that you can say about someone else, well, that could have been me, that's the nature of your response. So, for example, John Lewis heard about the death of Emmett Till and realized they were the same age, and then said to himself, that could have been me. And that actually launched his political career. And so it's this question of so this is happening to a little Latino girl over here. Wait a minute, that could have been me is a reason, to have a public health intervention or something that's going to affect and improve life for everybody. So I come back to Margaret Mead, who was asked, "What's the first sign of human civilization?" So, as an anthropologist, he was going through, fire circles or abandoned villages and things, and asked, "So, as you go through these places, what do you see is the first sign of human civilization?" And she said, "It's a human femur that has been broken and healed." So, for her, what that meant is that the community didn't abandon that person with a broken leg to the lions and the tigers, but they nursed them back to health. So there was excess food, right? That person's out of the workforce. So there's capacity to sort of keep that person for weeks, you know, immobilized and fed, and then probably some care for that person. And so that for her was a sign. It's really about empathy. It's like, we're going to take care of this person, of our family, our tribe, our group, who's broken their leg, and then nurse them back to health. And so I thought that was very interesting. It's like, that could have been me, is what, that forms the basis for society, right?
And that has gone on for millennia, right? For many generations. I had a college friend. We played soccer together. We're really, really good friends. And one day they needed volunteers to donate bone marrow for somebody who was going through leukemia. And I told this friend, "Hey, they're doing this drive. They just take a vial of blood, and if you're a match, they ask you to donate bone marrow." And this friend had a allergic reaction to that. "No, I'm not. What do you know?" And their argument was, "It's not my fault that they got leukemia. Why should I, give anything up for them when it's not my fault?" And again, the curiosity got the best of me. I said, "Hey, let's talk about this. Where's this coming from?" Sometimes I think I should have been a counselor. Where is this coming from? It came from a very abusive set of parents that basically had that mindset and transferred that to their child of, if I didn't break it, why should I pay to fix it? And it translated to many other things in their life, that they were against taxes, they were against big government, and this is Texas, and again, rugged individualism, right? And I said, "Well, you're not a really good soccer player, to be honest. Why should we have you on the team? What do you add to the team?" And of course, they were offended and and sitting there almost threw the milkshake at me. We're sitting at a restaurant, and I said, "But that's the mentality. Is we're in a team together, and if you're not contributing, the rest of us step up, because we're having fun, because this is good for us as a team. None of us are going to get to play in the World Cup, but this is super fun. Don't you agree?" And we're doing it to benefit each other. And I forget what else. I mean, this conversation happened almost 30 years ago, but I remember it because after that, they started on a path, and I haven't seen them in 20 years, but the next time that I saw them, they went and got help and dealt with the issues of the childhood. And that's how I learned about the tragic childhood, and how that affected. But it's, you magnify that at a population level, right? How we treat each other, how we've been treated by others, really influences how we treat the next person. And we lose some of that when we don't interact with people as much as we used to. The social media really has had an impact on that. And B, when others convince us that it's all up to us, right? You have to be independent. You have freedom. Don't let people tell you what to do. You can do this. You too can be a millionaire, right? And we lose that sense of cohesiveness. That the public and public health is gone. The public and public service, the community is really gone. You take sidewalks away from a neighborhood, and the isolation that ensues from people not walking over to meet their neighbors or meeting each other while they're out walking. The built environment gets affected. You see it in places that are undergoing some sort of gentrification that is set up. It's moving the community away to set it up for more individualism and more isolation as well. And that's trouble. That's troublesome.
Yeah. Well, as a counterexample, I would give you Minnesota, where the winters are cold. And if your neighbor's car is stuck, you help them dig it out, even if you don't like them. And so these deep bonds of community care and respect and support are built partly on an extreme environment. Like the climate is terrible in the winter in Minnesota, but it's created a very strong society where people across lines of race and ethnicity and language all help each other out. And we're seeing that in real time now. And so maybe what we're saying here is that what we've lacked for a long time is a major crisis, a major difficult event, a pandemic, a war, or something that brings people together and teaches them, wait a minute, you really do rely on your neighbor, right?
Yeah, and when I started working in Pennsylvania, my boss at the time, who was a veteran of Vietnam, we were talking about the assassination of John F. Kennedy, and he said that was a watershed moment for him and his generation. And I told him how my father had told me the story of him being in a Catholic school, and all of a sudden the nuns came in, grabbed everybody, and took them to the chapel to start praying for the president. And my grandfather told me, yeah, and the borders were closed because you couldn't cross from Texas to Mexico or vice versa, because this had just happened in Dallas, and blah blah blah. And my boss said, I wonder what the watershed moment for your generation is going to be. Little did we know that September 11th was coming up. And that happens. And there's a TV commercial that I forget who put it out there, but there was a TV commercial of like, they wanted to change America, and they did. And it's all these houses in a suburban area. And after 9/11, all the houses have the American flag outside. Right. And you saw this coming together. When in Little Waynesboro Hospital, we had tons and tons of units of blood because people went to donate blood on the off chance that most of the people at the World Trade Center had survived. We found out that it wasn't the case, but we ended up with a lot of blood because people just wanted to do something. I dread the thinking of what my daughter's watershed moment is going to be. Certainly we had the pandemic, but did it bring us together? I don't know. So many things got in the way, right? It was certainly some of us became closer to each other because we went through war together at the health departments, at the hospitals, at clinics, etc., nursing homes, things like that. But I don't know. And it's going. My thing about there's some colleagues of mine that have said, okay, you know what? Let's stop vaccinating and teach them a lesson. By them, they mean
that's a pretty harsh lesson.
And yes, it is pretty harsh. And who's going to pay for that lesson? The children, right? The children who didn't have an option, a choice in getting vaccinated or not. Their parents made the choice for them. And so they're the ones who are paying for this. Vaccines are not 100% effective. So a major wave of anything can hurt my daughter. I don't want to take those chances. So, do we need something like that to bring us together? Yes and no, right? I read the idea of it happening, and what that could be and what that could mean, not for myself, but just in general. The amount of pain that it would cause. Is it necessary for us to come together? It seems like it is. Are there other things that could bring us together? I don't know. I don't know anymore. It's hard to find another example right now on the spot. Maybe in 2 hours I can get back to you with something like that. But I really don't know something non-traumatic that could bring us all together.
Well, that's a good stepping stone to kind of closing thoughts. So let me ask you: Are you basically an optimist or a realist about the human potential to cohere and form, bonds of mutual protection, the way that public health is intended to do? Or do you think we're headed for atomization and anomie and loneliness and everyone out for themselves? That's sort of the rule of the jungle.
Well, I mean, the universe is going to end at some point, right?
Well, so, I mean, before that.
But way before that. No, at the end of the day, and I think you can tell by my personality and the things that I put out there into the world, I'm an optimist, because I have to be, because I've seen it in my own experience, right? Somebody has always come to my aid. When Bill Clinton signs that bill in 1995, Texas steps up and says, "Don't worry, we'll feed you. We'll give you what you need to keep going. When you get into college, you're going to have not the benefit of the GI Bill, but the Pell Grant, which is similar, came from the same line of thinking. You're going to get low interest loans. You're going to get very supportive professors at the University of Texas at El Paso. Big shout out to them. They're going to help you mold into somebody that can become something else, and so your next chapter, then you can contribute to society and do these things. I get to Waynesboro. Ray Minnick, my manager there, who's since passed away, becomes a great mentor, a father figure, so on and so forth. Just keep going down the line. Somebody has always come to my aid, and so I am willing to go to the aid of anybody who needs me. And I'm not alone. I've seen it in my deployments with local health departments, state health departments, with CDC. There's a lot of people who are, and Mr. Rogers said, look for the helpers, right? You see it all the time. You see the fire trucks flying down the road because there's an accident. The kid falls in the well. The whole town comes to get that kid out. I think it's still there. I think it's in our genetics, maybe from that initial femur fracture. That gene to help got transferred on, if you want to believe in that theory. But I am an optimist at the end of the day. But I'm also a realist in knowing and seeing the threats to all of this. And they're there, and we need to come together to face those threats. Misinformation, disinformation, loneliness, bad policy, bad implementation of good policy, corruption, all those things. We need to do something about them. We are doing something about it for the most part, but sometimes the forces can be more than what we can handle. But I again, optimist with a touch of realism, so that I'm not living in a dream state, and I'm living in reality and doing something about it.
Well, I'm gonna reluctantly agree with you. I think the American people, by and large, are smart, compassionate, other-directed. They understand exactly that, the need to donate blood, the need to, support their neighbors. I think most people are like that. There are people who are sadistic and cruel, and they are getting their moment. But I don't think that's the general thrust of American politics or American history. I think the American people really are fundamentally pretty good. And like, we have that to look forward to. Like, people really do come together in a crisis, and they understand education and logic and the importance of public health. And I think we have that to trust in. I mean, you and I would not be in the careers we're in if we didn't believe that. Right.
Yeah, absolutely. Absolutely. It's who we are.
So, I really want to thank you for your time and your thoughts and your candor. It was delightful to talk to you. And I hope we can do it again. This was terrific.
Absolutely. Anytime. I'm very happy to have come on and to have met you. And we did our prep session. That was really good as well. And to be honest, I think people listening should understand that I am not the rule, nor am I the exception. And yes, you can do things to get to be the director of public health at an NGO and teach at multiple universities. But you can also, you're going to face things along the way, and that's going to be okay too. And so I'm very happy to share that with you and your audience.
Well, and there's going to be no shortage of crises, and so I'm glad you're in your role, because we're going to need you.
Yeah. I wish that wasn't the case. I look forward to the day when I can retire and then the next generation takes over, and that I have left them in a position to do so. I'm working on that very intensely with my daughter, somewhat intensely with my students and mentees. So we will see what happens. But again, I am an optimist, and I hope it's all, when the death of the universe happens, we left it in a better place than we found
That's funny. The word retirement never enters my vocabulary. I plan to.
We've agreed. My wife and I have agreed. We're not going to retire. We see ourselves. I see myself teaching somewhere, and she sees herself treating patients somewhere. So, but maybe slow down. Maybe 10 hours instead of 12 a day.
Also, let's talk again when we're 100.
Yeah, we'll put it in the calendar for then. Yeah, and by then maybe it'll be just 2 AI models of us doing the conversation.